What is MyChart? So MyChart is our free, secure web portal that gets you access to your medical records. So you can view your test results, you can view your visits after your visit with your provider, you can manage your appointments, manage your bills, all that wonderful things. See how that went. We have multiple ways you can log in. So you can either do it on a computer, your phone, or tablet. And if you're ever admitted to the hospital, we have what's called MyChart Bedside, so you can follow your care while you're in the hospital. See your test results, communicate with your nursing team, and you can do that from your personal phone as well. Login screens. So this is what it will look like on your phone and on your PC. Keep in mind that if you don't remember your password, there is a forgot my password on there, so that's how you would reset it. We don't have access to your passwords. You don't want us to. I would always treat this like your bank account. It should be that secure. You don't want anybody else to have your access to your medical records. So sign up. Most of you already have signed up, so you don't have to worry about this part because you only sign up once and then you have it forever. If you have never signed up for MyChart, we can email you a link, we can text you a link, or we can help you to sign up in person. Recently, they added this two-factor authentication to MyChart, so that way you authenticate that you are who you are when you sign in. So it will send you a message on your phone or your device on an email saying, is this really you? Enter this code. If you don't want to do it, you can always skip for now and then just turn it off. Who can have MyChart? So anybody over the age of 12 can have their own MyChart account. Any baby that's born here at Astera gets automatically linked to that mother's account. And then you have adult access. We have something that's called diminished capacity as well. So if you have a special needs child that is unable to manage their own health care, so they have severe autism or they have Down syndrome or something like that, you can get what's called diminished capacity, and then you have full access to that child's MyChart account. After the age of 12, parents only have access to very limited items in the MyChart account. There's laws at the state of Minnesota that restrict what we can give to parents after the age 12. So how do you work through your MyChart? If you open up your MyChart, you'll see the header on top and then your menu. This little guy they call the hamburger. I have no idea why. But that's where you're going to find everything that you can access in MyChart under that menu. So if you click the hamburger, it's going to blow into all kinds of choices for you. You can also have quick actions here like visits, messages. So these are the 4 top things that people look at, but you can customize that toolbar if you'd like. This is what you'll see. Again, that hamburger up there, your quick actions, your care team, and then anything else that is pertinent. So if you've received emails that you have test results, if you've received emails that you need to set up an appointment, or if you have an appointment, it should all show up on this home screen. If there's ever changes to the system, they'll show up down here. There'll be updates. And you can open up that PDF and read what's changing.
I have a question.
Yeah.
Back to switch accounts up at the top.
Yep.
I have my mother's and my son's on with mine, but I can't get both of them to show. I only get one, my mother's to show.
Oh, okay.
So, but if I go into the email, I click on his and then I can and get his up that way.
I think they're not linked correctly. We'll have to look at that with you.
All right.
Yeah. Scheduling an appointment. So currently, all of our providers in the family medicine site have what's called direct scheduling. So you can schedule with anybody that you've seen in the last 3 years an appointment with them on MyChart. Starting in May, we will start doing what's called open scheduling. So you can put yourself on any schedule for any provider as long as they have an opening. You don't have to have previously seen them. We already do this with our orthopedics and with our chiropractic. In order to do it, you have to go to your appointment scheduling, and there's a little tiny button here that you can't really see on my screen, but you might be able to on your papers, that says find a new provider. Then it will direct you through, do you want to see orthopedics, family practice, who do you want to see, and it just kind of steps you through scheduling that appointment. We also have scheduling tickets, so if you have an order out there for a DEXA scan or a mammogram, you can use that scheduling ticket to schedule those. On my way is a way to say you are on your way to see someone in the urgent care setting. This can be accessed from our website. However, if you have MyChart, it's much better if you just log into your MyChart and do it through your MyChart. Again, through that Find a Provider. That will put you on their track board that says you are coming at some point, so they know that you're out there, and then once you show up, it'll put you on their actual schedule. E-check-in. So when you come in for a clinic appointment, do they do it at ambulatory too, or infusion? Yeah. So when you come in for an appointment, if you can do your e-check-in, it will be a lot quicker once you get to the clinic. So they're going to verify your demographics and insurance, your medications, your allergies, any health problems you have, and then ask you to fill out some questionnaires in relation to your health. Then when you get here, they have all that information. They don't have to go over it again with you. MyChart questionnaires. This is how we gather information about you. So if you have a specific disease process, or if you are coming in for a Medicare wellness visit, there's certain things that we have to capture for those visits. So we assign MyChart questionnaires so that you can fill them out when you're sitting on your couch in the evening, and you can take time to really read them and answer those questions. As opposed to coming here and then sitting out in the waiting room and having to fill them out real quick because you're worried you're going to be late for your appointment and I got to rush and do this. We get better answers if you can just do it at your leisure. And then all that will be done. You'll get roomed much faster. These are all the questionnaires that we assign. There's a few. They're all for different things. So for instance, if you see the diabetic educator, you're going to get some different questionnaires, as opposed to if you're just coming in for a Medicare wellness. The Medicare wellness questions are required for Medicare. So we have a checklist from Medicare that if we say this is a Medicare visit, we have to meet all the little check boxes in order to actually bill that as a Medicare. If we don't meet all those little check boxes, they'll kick it back and say it's not a Medicare wellness. You have to bill the patient. They won't pay us for it either. So that's why we have them fill out these questionnaires with that visit when the nurse calls you on the phone and questions all those things. That's what she's doing, is this stuff ahead of time to review those questionnaires so that you don't have to do it when you get to the clinic. And then we have social factors, or we call it social determinants of health. These are non-medical factors, but they all affect your medical journey. So if you are having trouble with transportation, you can't get to your visits. If you have trouble getting food, or if you're having financial strain, or all those things contribute to your overall health. So we want to make sure that we ask these important questions, and then we can review them with you and say, what can we do to help you to get food or transportation, or what can we help with that financial strain you're feeling because of whatever the reason? so that it doesn't burden you and affect your health. We also do surgical questionnaires prior to your surgery. And then we get to test results. So, we talked about that main activities bar. If you click on test results, it will take you to your tests. It will also explain what the provider tells you to do about your test. If it's high, low, normal. You can compare trends in your test. So if you click that button that says compare trends, it will show you a graph that, does it go up, does it go down, does it stay the same? I, for myself, think that that's affects me a little bit more than if you just read me a bunch of numbers and I go, yeah, that's bad. But if I look at a graph and see, oh my gosh, my weight just went up 50 pounds. Maybe I should do something. You'll see test results from the hospital side as well in here. And then what your provider says about the test. Remember that you see the test as soon as it's resolved or resulted. So if you have a test run, your provider gets it at the same exact time you do. If they're seeing patients, they're not going to get to it. So give them some time to actually address that test result with you. After visit summaries and notes. So if you go to your visits button, you can then see when you've seen a provider, you can see what they'd said on the after visit summary. So remember that paper that they print out sometimes for you with your medications, your next steps, patient instructions, all that is on there. You can also see that in the computer on your MyChart. And you can view their notes. So what did they say when you were in that visit? What was their plan for you? You can review that later so you can follow through with that stuff. You can also share your record with different facilities, with your family members. So if you have children that also doctor with us, you can attach them, what we call a proxy, and they can have your test results and stuff if you choose to do that. We have ways to track your health. So we could send you what we call a flow sheet and have you enter your blood pressures, glucose, and weights so we can track those items and trend them for you without you having to retype them all in a big note to your provider and then they have to enter them, and it's a lot more work for everybody. So if we send you this, you can just enter it and it goes right to their in-basket. And then you have a health summary. So here's where you can see your current health conditions, medications, allergy lists. Do you have an immunization history? And then any health-related preventative things that we can do. So this would be if you're diabetic, you're going to have one in here, how often you need to check your A1C, or how often you need an eye exam, how often do you need to have your feet checked, your foots. And then if you have any special conditions, like you're on insulin or asthma, you can see what your provider's plan is for you in regards to those two areas. So they'll enter all the insulin information into what's called insulin management, and then you would have access to that on your MyChart as well. You can message your provider. So if you click on messages, say send message, and then it's going to pick what kind of message you send. So if you want to request an appointment, request a refill, if you have a medication or a medical question, customer service, these all go to different people. That's why we have them spelled out like this, because then it will get to the right person if you click the right button. Keep in mind that when you send messages, they shouldn't be urgent messages or things like I need help now. That should all go through ED, 911. Somebody might not see these that second when you put it in. So if it's an urgent matter, you call, come in, We wouldn't use MyChart for those items. And then remember that your provider, they've tried really hard to get back to you within 48 hours of these. However, they're seeing patients all day. So if they don't get to their in-basket, they may not answer these until after hours. So give them some time to answer them too. You can see your bills and review your statements. I put this one on here because if you want to see your past history, you have to click this View Balance Details. And then it will open up your history of what you did when, paying bills, your bill history, your detailed summaries. All those things will show up there, but I don't feel like this is very intuitive on what you get when you click that, so.
I have a question. So I've been using MyChart, and now I have an appointment tomorrow, and I got a message saying what my bill would be. And that has never happened before?
Yeah.
Is this something new? Or?
It is. It's just it's an estimate on what it possibly could be. However, we found that they're not 100% all the time. So we're working on that project now to get those to be accurate and not send them to you if it's not appropriate. So you can just ignore that.
Okay.
Yeah.
That's what I had chosen.
Yeah. Yeah, if it's something that has to be paid before you can do that service, our patient financial advocates will reach out to.
Oh, yeah, my insurance has covered everything.
Yeah, that estimate tool has been a little wonky lately too, so, yeah, so we are working on that. Yeah, just wait for the bill.
So
Kathy?
we will actually get a bill? Yes.
If you have not, well, so we do have electronic billing right now. So if you want a paper bill in the mail, you have to go in and turn off that electric bill or electronic billing.
So that's on this page somewhere?
Correct. Yep, it'll say on here somewhere there's a link for turning off. Yeah. Oh, sure. There's a link in here if you have that turned on to turn it off. So you have to click on here and then,
Is it under payments or?
I don't have a screenshot of it, so we'll have to look at it. Yeah.
So I prefer to get my billing by paper.
Mhm.
I don't want to do it. this
Yep.
way. So I just press that button.
Yep. To turn it off. Yep.
Are you saying it defaults
Yes,
to online?
it does.
Boy, that's really bad.
Paperless.
Because most people wouldn't know that. It's not intuitive.
There was a message for quite a long time on there that had happened and how to turn it off, and that gave you a link.
On MyChart?
Yeah.
Yep.
Yeah.
That's why we're here.
That's why you're here. So there's multiple things you can do in MyChart. It should be a kind of a one-stop shop for anything that we have in your record and that we share with you guys. We share almost everything. There's very little anymore that doesn't get shared with the patients. Benefits of MyChart. So studies have shown that the more in tune with your health care and involved you are, the better decisions you're going to make and the healthier you will be. So that is the main reason we have this tool, so you can keep up on your health care and make decisions about what your next steps are. And then if you have trouble, we have a helpline that actually goes to Steph and myself. You can ask a staff member, a nurse or registration can help you and direct you in the right area. Or if you wanted to stop and make an appointment with one of us, we can sit down with you as well.